Okay, hi everyone. Thanks for joining us today. This is Building Healthy Communities, Engaging Middle Schools through Project Healthy Schools. So today we're going to talk about exactly what our program is here at the University of Michigan and talk to you about our request for application process for the 2025-2026 school year. So welcome aboard. Okay, so BHC, Building Healthy Communities, is a partnership across the state of Michigan with a few different partners. So we partner with the Blue Cross Blue Shield of Michigan, the University of Michigan Project Healthy Schools, which is where we are from here at U of M, Wayne State University Center for Health and Community Impact, and the United Dairy Industry of Michigan. So we have been expanding our program out through different programs. We have the Step Up to School Wellness Program. We have the Health Disparities in Elementary Schools program, and we have the Engaging Middle Schools through Project Healthy Schools program as well. So three different programs to really support school wellness across the state of Michigan. So in today's webinar, we're going to be covering these different topics. First of all, what is the BHC PHS program? So we're really going to focus on that program of the three BHC programs here today, which really focuses and highlights our middle schools across the state of Michigan. Who is eligible to apply? What is the PHS program and our 5 steps to school wellness model? What type of resources do we provide to our participating schools? Expectations for participating schools, how to apply, their criteria for selection, and the key dates. Okay, so as I'm sure you all are aware, our current landscape across the state of Michigan, we have a lot of unhealthy messages coming across to our students, whether that be at home, through different media outlets and mediums, or even possibly throughout your school environment. They're constantly being inundated with different health messaging, and those messages, both indirectly and indirectly, can really directly impact their health behaviors and the choices they make throughout the day. So middle school is a really great time where our students are becoming a little bit more autonomous with their decision making, and they're becoming a little bit more having ownership of what they do throughout the day, whether they pack their lunch, or they might choose their breakfast or their afternoon snack, or they might choose exactly what they're going to purchase eat in the lunchroom at your school. So this is a really great vital time to help students make those healthy options and to make sure that they have a plethora of healthy options to choose from. So PHS was founded back in 2004 here at the University of Michigan. We are currently celebrating our 20th year of school wellness impact, which we're really excited about. And we are a community and University of Michigan collaboration program that is evidence-based, and we work to improve the present and future health of youth through education, environmental change, and community engagement. So we work with middle schools across the state of Michigan to really assess their school wellness culture and to really make that school wellness culture as strong as it can be, and to really help the health of both students and staff within the school community. Okay, so like I said, our program started back in 2004, and we joined the BHC program family back in 2013. So we have been really having a long-standing partnership with Blue Cross Blue Shield of Michigan to really expand this program out across different schools across the state. So we currently have reached over 140,000 students served, and we've reached over 150 schools across the state of Michigan. So we have really great impact, really great reach, and we're thrilled to be offering more schools to join our program for 2025-2026. So the program goals is really to create a sustainable framework for school wellness. And we really pride ourselves that we really tailor our program to each school's needs, realizing that each school has a different community of people, different environment, both internally and externally. So we want to really come in and offer you assessments and tools and resources to make your school as healthy as possible. So our evidence-based program really promotes 3 goals for our students and staff. 1, to consume a variety of healthy foods and beverages. 2, to be physically active every day. And 3, to engage in healthy behaviors to reduce the risk of cardiovascular disease. So by doing all these different things, your students are going to become better learners. And if they're better learners, they're going to be more successful both as youth as well as future as adults. So very important. So across the past 20 years of impact and measurement, our program's seen a lot of different really great, strong success. So this kind of highlights and showcases a few of our different successes of really changing these behaviors of what students are eating, how physically active they are, what type of screen time do they engage with, whether it be active or passive screen time. So lots of different health behaviors we really target to really get our students thinking critically and to really make that healthy choice where possible. Okay, so let's talk about who is eligible for the PHS school program. So this program is offered to any public, charter, or private nonprofit school. So it's very inclusive to basically any type of school across the state. It's open to all schools, regardless of their free and reduced lunch percentage that their students are eligible for. So regardless of what that percentage is for your school would still be eligible to apply. Geographic location, as you saw on that map, we have PHS schools located literally across the entire state, both Lower Peninsula, Upper Peninsula. So regardless of whether you come from a small rural community or more of an urban, larger community, regardless of if you're a K through 12 school or middle school, your school would be eligible. If your school is participating within other health programs, whether that be Fuel Up to Play 60 or other health programs, Peanut, other types of programs like that, you would still be eligible for our program. We love to collaborate with other health programs across the state of Michigan, and we love to really maximize and synergize our energies together. So that would definitely be something that would not exclude you from participating in this program. The one thing is if you've already received a BHC program, whether that be Step Up to School Wellness or Wayne State's elementary program or the PHS middle school program in the past, one of those three programs, you are not eligible to reapply. So schools are only able to ever receive one of those three programs. And so we do have a list that we can provide you, or we can check your school for you to see if you're on that list if you already received a BHC program. So that would be just one thing to be mindful of. Schools can only ever receive one of the three programs. If you've applied in the past to any of the three, but you were not selected, you are still eligible to reapply. It's only for those who have actually been accepted into the program and accepted that offer who are no longer eligible to reapply in the future. And so for our middle school program, we currently serve students with our curriculum in the fifth, sixth, or seventh grade. So your school would need to have at least one of those three grades. You don't have to have all three, but at least fifth, sixth, or seventh grade in your school. Whether you're K through 12 school or whatever type of grades you offer, as long as you offer one of those grades, you would be eligible to apply. Okay, so let's dive into our 5 steps to school wellness. So really, this is a framework for our program when we work with middle schools across the state. So we have a step 1, we build support. 2, we assess the school wellness culture. 3, we make an action plan. 4, we take action. And 5, we measure success. So let's dive into each of these steps a little bit further. So all of these steps are going to be provided to you in our PHS portal. So the PHS portal is a password protected website. So your principal, your wellness champion, the teachers teaching our curriculum, they would all have access to your school's username and password. So you would receive access into our portal. And basically, throughout that, you can really utilize our entire program in that portal for your school. So our 5 steps are located in the portal. Our 10 lessons and all the materials for that would be located in the portal for you as well. Any type of wellness event ideas you have or other resources for the program would be in there. And any up-to-date news, videos, and announcements would all be in there as well. So it's a really quick, great go-to for schools. All of your resources are right there for you. So you'd be trained on the portal when you were to be accepted into the program. And that's really kind of where you find all of our house materials for you. So step 1, build support, is your school would first identify a wellness champion. It could be one champion, it could be 2 champions. Basically, this would be a staff member at your school. It could be an administrator, it could be a teacher, really any type of staff member at your school who has leadership abilities, who has strong communication skills, and really who has a passion for health and wellness. So once you've identified that person, you would work with your administration team to really form a wellness team. If your school already has a wellness team, that's great. We would maybe help you kind of enhance that team to make sure you have equal, inclusive representation on that team. Or if you don't have one, we would definitely help your school create one. And then once you have your wellness team created, that could be including other teachers, administrators, food service director, maybe parents, a student would be great to have on that team. After that, you'd really then engage your entire school community, both students and staff, to get them excited about the health work we're going to be doing together. Step number two is we assess your school wellness culture. So we look to see how is your school currently doing. We look at your lunchroom. That would be where you'd also collaborate with the United Dairy Industry of Michigan to really assess your school lunchroom. They would provide different resources for you that you could utilize to help improve and enhance your offerings in the lunchroom. Um, Here on the slide, you see the HSAT, so that's the Healthy School Action Tool. This is a state of Michigan based school wellness assessment. So we would be assessing your school at large for wellness. And then we would have you be doing two different topic areas. One would be regarding healthy eating, and the other one about physical activity. And then there's a few other assessments you could also take if you wanted to, that looks at other areas of health as well. So we look at your lunchroom, we look at your whole school environment, just to kind of see how you're doing and to kind of see where we might want to go with your goals. For step number three, you would be making an action plan. So we call this a SWIP. So that stands for a school wellness improvement plan. So for this one, your school would be creating 4 wellness goals that you'd want to accomplish that school year. So we're not really looking for a few years down the road. We're looking at this current school year. So for your school, it would be for next year, 2025, 2026. So with your goals, you'd be creating 1 nutrition goal for your school, 1 physical activity goal for your school, 1 staff wellness goal for your school, and then the last goal would be school specific. So really, what would be a health topic area that you want to focus on for your school? Is it caffeine? Could it be possibly vaping? Possibly sleep? So all those different areas that you think your school needs to focus on, you could use that for your 4th goal. And then once you have your 4 goals created, you'd be creating 1 wellness event for each goal to really put that goal into action. And so those wellness events would really be school wide, and it would impact your entire school community. So that would be step number 3. Step number 4 is where you take action. So first of all, you'd be teaching our 10 lessons. So we have 10 lessons that really look at nutrition, physical activity, and for the current school year, for next year, we're going to really be also offering other topic areas, which I'll talk about in just a second. You'd also be implementing a social emotional learning curriculum. So we had partnered with our program with the Michigan Model for Health. If you already have an SEL curriculum that's working well for your school, you can keep using that. But if you don't have an SEL curriculum, we would then connect you and get you trained on the Michigan Model for Health curriculum. So you'd be implementing the 10 lessons. Again, those would be for one of your grades, either 5th grade, 6th grade, or 7th grade students. And then you'd be implementing those 4 wellness events that we just spoke about from your SWIP from step number 3. So these are different health topics covered in our lessons. Our lessons are evidence-based and they are very hands-on. We have a lot of great props that your students will really engage with, that they really enjoy. So the different health topics we're covering are nutrition, physical activity, screen time, caffeine, sleep hygiene, vaping, tobacco, and a little bit on dental health. So a lot of different really great inclusive topics to really discuss health with your students. And then social emotional learning as well. So obviously there's a lot of different variations and importance to both physical and mental health and emotional health, whether that be stress management or emotional regulation or just more self-awareness about both yourself and others. And so these are things that really help, again, holistically keep our students happy and healthy and, becoming better students and adults in the future as well. Okay, and then with those wellness events, we also look at what we call PSE, so policy, systems, environmental. And so really this would be working with your wellness coordinator, which would be our PHS staff member, to really making sure that your events are inclusive, to make sure that they are really meeting the needs of your school. And your 4 wellness events would really be targeted at the entire school. So the curriculum is really based on one school level of students, whether it be 5th, 6th, or 7th grade. Your wellness events would really be school-wide impact for both students and staff. So a really great way to engage the entire school community. Okay, and then step 5 is we do assessment. So before we even implement the curriculum, we do have you do a pre-health behavior questionnaire. We call that the HBQ. That would be for all of your students who are going to be receiving the curriculum, the PHS curriculum. They would take that assessment before. And then after all of the wellness initiatives, the wellness events, and the curriculum has been implemented, they would take the post HBQ health behavior questionnaire. We also have another post lesson survey for both students and teachers to provide feedback on our curriculum. And then you'd be really sharing your success stories. So sharing photos, sharing success stories about how the curriculum went, how the program went, and just talking about how the program impacted your students and staff. Okay, so our program offers a lot of really great resources. So you would have a PHS wellness coordinator that would be a member of the PHS staff here at University of Michigan who would train you and your teachers on our program, really mostly working directly with the school wellness champion to really get trained on the portal, get trained on the curriculum. We would also meet with your administrator to make sure they fully understand the program and that they're trained as well. And then we'd also train your teachers who'd be teaching our PHS curriculum to make sure that they fully understand the curriculum. And the curriculum is a scripted curriculum, so it's scripted out in the portal for you. So even if you choose to have the lessons in a topic area or with a teacher who doesn't necessarily have health as a background, everything is fully scripted. So once they're trained by our team members, they would feel very confident to teach the students the curriculum. And as I mentioned before, it's very hands-on, very interactive, and you would have access year-round to the portal, so you could always review different things in the portal as well if you need more resources. So you're going to be definitely well-trained and well-supported throughout the school year. Okay, other types of resources we provide is we provide funding. So we have you as part of step 2 when you're assessing your school wellness culture. We're going to also have you assess your PE equipment to really look at how are you utilizing physical activity before school, during school, and after school. So you'd be doing an inventory of your current PE equipment to see what might need to be replaced, what might need to be added to enhance your PE offerings to get students and staff more active during the day. And so we would purchase that for you. And also, we would be funding your 4 different wellness events. So those different events we'd be funding as well for your school. And then we also have a great wellness champion network. So with 150 schools we work with across the state, we bring them together once a year for a wellness champion retreat. It's a gathering, we call it the Wellness Champion Gathering. So that's typically held in the fall. And we've actually moved to doing that more online. So it's virtual to make it more inclusive. So all of our schools across the state can come together and receive sketchies for a continuing education day of learning together for PHS. So we're really excited to offer that every fall. Okay, so what are some expectations for our school? So really making sure that your administration team is on board with the program, that you have a really strong wellness champion, that you're willing to create a wellness team to get engagement across the school for the work that we'll be doing together. For the wellness team, we do require a minimum of 4 wellness team meetings each school year. That would be a minimum, but we do really encourage schools to meet monthly if possible, just to keep these conversations going and keeping the work going throughout the school year. You'd be having regular meetings with your PHS wellness coordinator. They would, again, train your school and really provide that hands-on support you need to be successful in the program. You'd be receiving technical support for your duration of your participation. And your school will be doing all the different assessments, especially during year 1. We do a lot of assessments and measurement in year 1 of the program. So really making sure that your school is on board for that measurement and assessment and really utilizing your school wellness team. So we don't want all ownership onto the wellness champion. We really want that wellness team to support that champion of your school to make sure that the work is being distributed and that it's getting done appropriately. Okay, a few other things. So you'd be also meeting with the United Dairy Industry of Michigan to assess your school lunchroom. You'd be teaching our 10 lessons to one of your 5th, 6th, or 7th grades. You'd be trained. Everything would be provided to your school at no cost. So there's absolutely no cost for our program. Everything's provided to you free. You'd be teaching the SEL lessons, either the Michigan Model for Health curriculum, or if you had your own current SEL curriculum that's successful, that's great. You can continue with that. You'd be creating and implementing at least 4 wellness events that impact your entire school community, measurements, success stories. And really, once you join our family and our program, we really would love for you to stay with our program for here on out. So every year, not just year 1. And really you'd be receiving resources from our program. They do change slightly every year, but really we really want you to be part of this network long term, and we would keep funding and supporting your school indefinitely. So that's really the goal. And then a really great new initiative for the 2025-2026 school year is we have a new partnership here at the University of Michigan, and we will be piloting a new program next year for the Michigan School Safety Initiative. So that will be providing schools who are interested with a assessment of their school safety culture, and then also providing schools who are interested evidence-based resources if they're interested. So another great collaboration for next year. Okay, so how to apply? So you need to go to the PHS website. The link is located right here in the slide. So you want to go to our Apply Now tab, and there's a lot of different information. You can pull and download our documents for the request for applications that dives all into all these different items a little bit more in detail there. And then the online application is located there for you as well. So once you submit your application online, we'll receive it here at U of M. We'll review your application. And then if your school is still eligible to apply, which means you basically have not received a BHC program in the past, we would reach out to your school and schedule an interview with your wellness champion that you've identified, as well as your administrator. And then we would do most likely a remote virtual meeting, just kind of talk about the program, ask you a few questions. You can ask us questions, a little get to know you. So that will be happening as well. And then all final applications would be due by 11:59 on April 30th of this year. Okay, so to be competitive, really make sure that you complete your application fully, as best to your ability, making sure that you have commitment from your administration and that you have a strong wellness champion identified, making sure that you've identified which grade level would receive the lessons as well as what class. So whether that be a health class or whether that be a science class or whether that be an advisory class, we're very flexible with that. If it has to be PE class, that's fine, but we also don't want to take away, because a lot of our lessons, even though they are hands-on, they are somewhat also discussion and lecture based. And so if it's in a PE class, we don't want to take away too much away from that physical movement of that class. But if that's really the best place for your school, of course, we would support that. And then again, looking at how you're committing to our program with our 5 steps. Okay, so like I said, applications are due by April 30th, by the end of day. We'll then reach out to your school for interviews. And then our goal is to have all schools interviewed and reviewed by May 30th. So then we would have awards announced by the end of May. So that way your school will be able to accept the program and have everything finalized before the end of the school year. And then the program would be starting in the fall. So if you have any questions, please do not hesitate to reach out. Here is our PHS team email. You can contact our program there. You can also contact me. I'm currently the interim program manager for Project Healthy Schools. So my name is Brad Newman, and this is my email address here at the University of Michigan as well. You can email me if you have any questions. So thank you so much for taking the time to learn about our program. We would love to discuss the program more with you if you have questions. And please review our application, our website, and please submit your applications by the deadline of April 30th. Thank you so much.